Attention, Medicare beneficiaries. If you have a Medicare Advantage plan or a Medicare prescription drug coverage plan, please do not skip this ads because this video is very important. It is for you, okay? Medicare Advantage plans and Medicare prescription drug coverage plans are calendar year plans. Those plans are subject to change year after year. In fact, some of the Medicare Advantage plans network have changed mid-years. People have learned mid-years that their plan network changes or their doctor is no longer in that network. Their specialist is no longer in that network. Okay. Now, it doesn't usually happen, but it can happen. So I'm just telling you now, Medicare Advantage plans and prescription drug coverage plans, guys, are calendar year plans. They usually change year. They are subject to change year after year. Benefit change, premium change. If you have a premium, or if you have no premium, you may learn that there's a premium that you didn't even know about. Network changes, co-pays, co-insurance, benefit changes, plan goes away, plan stays. So there's so many things that can change in year after year if you have one of those plans. Now, when it comes to prescription drug coverage, guys, prescription drug tier change. So when we're talking about drug tier change, we're talking about the co-pays may change on a particular drug. Formulary changes, okay? A drug may no longer be covered. So there's many things that can change year after year with those plans. So that's why October 15 through December 7 is a very important date for all of you out there who has a Medicare Advantage plan or a prescription drug coverage plans. Notice I didn't even mention about Medicare supplement because a Medicare supplement usually are stable. Okay. If the agent who actually helped you with a supplement did a great job, you generally don't have to do much anything really. Unless you're experiencing a big rate increase in that supplement, then that's a different conversation. Then you can always explore our option to see what other supplement you might be able to get qualified for to actually save you on premium. But the benefit on a supplement are generally standardized and they really don't change. It's always the same, right? Generally. So I'm not really focusing about the people who has a supplement for that purpose, because if you want a supplement and if you can afford that supplement, you're good to go. Okay. Now I know most of you who are on the supplement had to have a prescription drug coverage. So that prescription drug coverage, guys, look at it, review it, and see if you are in the right plan. Hi, my name is Jim Noel, independent insurance broker here in the state of Florida, and I'm also licensed in many different states. So if you are looking for an independent insurance broker to go over all your plan options with you guys, feel free to call me. My number is at that number on the screen, 561, or you can actually book me up at iQuoteMedPlan.com. Fill out that scope of appointment on the website, iQuoteMedPlan.com, and that way I can reach out to you. Now, I'm a one-man operation. I don't work for a call center. So when you fill out your information, it's coming straight to me, guys. It's not going to be redistributed across the country to different people. You're not going to be bombarded with phone calls all over the place. I know the feeling, trust me, because I used to work for call centers before I become a independent insurance broker. I used to work for many different call centers, and I used to be a captive agent as well. So I know how these things works. Okay. Now, I highly recommend you book me up at iQuoteMedPlan.com. Fill out that scope of appointment so I can reach out to you. If you call me, if you get a busy signal or busy ringtone, okay, the line is still open. You still can leave me a detailed message with your name and callback number, and I can reach you back. Okay. Now, all of us has to make a living, right? I am an independent insurance broker now. I'm no longer a captive agent. I used to be a captive agent. Now, how do I get paid, guys? I get paid when I enroll a client in a qualified health plan. Okay. Now, one of the thing, when the beauty of working with an independent insurance broker like me is that I partnered with different carriers across the country to help provide a unique solution for my clients. Okay. Now, a captive agent, when I used to be a captive agent, guys, I used to be a seasonal captive agent. So that means around this time, October 15, December 7, That's basically the time that I'll be on the phone with people, right? And then after December 7th, they let us go. It's bye bye, everybody. That's how I was when I was a captive agent, because they were actually, because there's a big flow of incoming calls. Some of us had to do outbound calls, all of that thing. Okay, so I know exactly how the operation works. So I used to be one of those agents again, working there. And after the season is over, even if I help somebody and even if I build that the greatest rapport with that person, they can't really get me back. Okay. Because again, I was only a seasonal worker there. Okay. And as you can see, also as a captive agent, guys, I was only allowed to talk about one specific company products. Okay. Whatever company products it was, I was only able to stick with that company products or services or plans. I was not able to talk about other company offering plans with you. Okay, so that's the limitation of a captive agent. So when you talk to an independent insurance broker like me now, you'll have more options. Okay, you're gonna have more options, and you also have a point of contact. So if something happened, I mean life changes, if something happened, you can always reach me back and I can always explore different options, assess your needs to see if you're in the right option at that point. So that's the beauty of having an independent insurance broker when you're working with an independent insurance broker as your agent of record. Okay, what else I would want to say tell you is, oh, okay, one more thing. Whether you go with a captive agent or you go with an independent insurance broker, it doesn't make a difference in your benefits. It doesn't make a difference in your premium. Everything is also is already calculated from the top. Okay, so it's not going to make a difference in your benefits or premium. The beauty of the independent insurance broker like me, you'll just have more options. You're going to have more options and someone to talk to who can always reevaluate your situation. Okay, if something changed, you can always call me, and I can also explore options with you to see where you can save the most. Okay, where you can get the most benefits as well. Okay, so that's the beauty. All right, guys. Again, my name is Jim Noel, independent insurance broker here in the state of Florida, and I'm also licensed in many different states. So feel free to book me up for that consultation, free of charge, no obligation to enroll. I look forward to talk to you guys, and I hope it doesn't matter if you go with me or another broker. I just want to make sure you guys okay, because I've seen it. People wait and they learn it the hard way, and I don't want that to be you guys. Okay, I'm look forward to talk to you. Hopefully, I'll talk to some of you out there who has watched this ads. Feel free to share this video if you know someone who is on Medicare and who has a Medicare Advantage or prescription drugs. If you have a friends or family who has a Medicare Advantage or prescription drug coverage, feel free to share this video to them, and I think it will help them. I'm also trying to build a community, guys, also on YouTube or Facebook or TikTok. So if you want to be part of that community, feel free to follow me or subscribe to me or find me on those social pages. I quote MedPlan. That way, again, when I post new content, new videos on those social platforms, you'll be notified. All right, guys, take care. I'll see you guys on the next one. Peace.